I am grateful that I am sharing the stage with a lot of eminent cardiologists of the India, and I'm thankful to the EARCON. And also, I am apologizing that my topic is not included in the heart failure symposium. It is something different, so that this could be just ignored. So let us have some, my topic would be based on the Everolimus Eluting Stent, and just have a look about the historical milestone about the last 50 years. We have achieved a lot. From the 1976 to the starting of the balloon angioplasty by Andreas Gruijing, and then the first coronary stent in the 1991, in the mostly in the 20 years, we have achieved in 2011 the biovascular scaffold without metal. So this is the era where the golden era of the interventional cardiologist, and there is a lot of human benefit from this discovery of the stent. So what problems we encountered during the stent technology? The first bare metal stent, they have a lot of restenosis, and this is taken to be the intimal proliferation. So then the cytotoxic drugs or the antiproliferative agents comes into the role, and then the first generation stent, which are paclitaxel eluting drug stents, they came to know that the restenosis rate is lower, but comes with a thrombosis rate. Then the second generation drug-eluting stent, that is the Limus family, and these have a lot of beneficial effect where the restenosis rate is lower, the thrombosis rate is lower, and then we have right now the biovascular scaffold, but the problem with biovascular scaffold is mechanical performance. So my topic will be based on the drugs, but there is three things in the stent, where the stent metal, the polymer, and the drugs. So both all the three plays a role in the achieving a better outcome. So with the second generation drug-eluting stent, we have a thinner stent strut technology, and also the biodegradable polymer, which helps in the achieving the final outcome. So what is the difference between the sirolimus and the everolimus is just a molecular advantage or molecular difference between the sirolimus and the everolimus, but everolimus achieved a higher bioavailability and a shorter half-life than the sirolimus, and so it has found out that it decreases the vascular inflammation and promotes the rapid endothelization. That is the main thing where the Everolimus nowadays become the most widely used drug-eluting stent in the clinical scenario. So these are some of the commonly used stent in our day-to-day practice, and we will find out that mostly the Giants family, the Giants Alpine or the Giants Sierra, have the Everolimus as a drug, and also the Synergy, which is found out to be a most widely used stent, and these are having the Everolimus. What other drugs we have in the Limus family is Jotralimus and the Biolimus, and other drugs are on the point of discovery, and also their luminal coating. So first, let us review some of the clinical outcome about the Everolimus Eluting Stent. So I'll go to straightforward the meta-analysis about the Everolimus Eluting Stent versus the paclitaxel eluting stent, and these are the SPIRIT clinical trials program. The SPIRIT is from class 1 to 4, and this meta-analysis showed that in comparison to the paclitaxels, the Everolimus Eluting stent, the target lesion failure is significantly reduced. So it has almost reduction of 29% reduction in the target lesion failure. And what is more important is all-cause death and myocardial infarction is also reduced by almost 30 to 40%. So this meta-analysis showed that Everolimus Eluting stent, or the second generation stent, is actually beneficial in the clinical scenario. But another very important point comes from this meta-analysis is the stent thrombosis rate. So the stent thrombosis rate has reduced in the Everolimus Eluting Stent in comparison to the paclitaxel eluting stent. And this Everolimus, mostly because of this reducing the vascular inflammation, have a controlled intimal proliferations, and all these drugs has a beneficial benefit in the reducing the stent thrombosis, but we should just not ignore the stent technology also. So the conclusion from this meta-analysis that this emphasized that stent selection decision can markedly affect the long-term outcome of the patient with the coronary artery disease undergoing the PCI. So we have to individualize the stent choice when we're going for a clinical field. So one important aspect about the decision making is the diabetes mellitus. So diabetes is a patient which we have found out that that a lot of stent thrombosis rate is higher, and this meta-analysis showed that Everolimus Eluting stent has a significantly lower rate of stent thrombosis in the diabetes mellitus. Then also there is a difference between the paclitaxel and Everolimus Eluting stent. This is the Tuxedo India investigator trial. This is the Indian data where the stent thrombosis rate is found out to be significantly better in the Everolimus Eluting stent. And this is true in all subtype of the patient. So another drugs, another stent where comparable is a Jotralimus and the Everolimus, and this is that the 5-year report from the Resolute All-Com trial. So Jotralimus and Everolimus coronary stents found to have almost similar efficacy, and these stents have equally good outcome during the long-term outcome. So the second generation stent about the drugs, the Everolimus and Jotralimus, is almost comparable. Now, this is the 1-year data of systematic analysis and meta-analysis of six randomized control trial about the stent thrombosis, because stent thrombosis is one of the important factors when we choose the choice of the stent. And so Jotralimus is also comparable to the sirolimus in reducing the stent thrombosis. So real world data is very important. The real world data, this is the real world data from the USA, the Giants V USA, where you can find this important point is DAPT interruption because of the many reasons. The DAPT is interrupted within 6 months. Even if the DAPT is interrupted within 6 months, the data showed there is not a marked increase in the stent thrombosis. So stent thrombosis rate is almost equal or comparable. So this real world evidence also suggests that the Everolimus Eluting stents are equally benefit. And this data comes from the India, the real world data from the Giants V India, and Giants V India has a similar result from the Giants V USA. So about some imaging study that is OCT and IVA study about the Everolimus Eluting stent versus the Jotralimus Eluting stent. We will not go to the first generation drug eluting stent. So Jotralimus and Everolimus, both the stents you can see by the OCT trials that the uncovered stent stress or the stent foreshortening is equal, and this is almost comparable. So Everolimus Eluting stent is almost comparable to Jotralimus Eluting stent when the imaging study has taken up. And this is the second IVA study, the restent ISR. The restent ISR also showed the neo-intimal volume, the late luminal loss, and the percentage of luminal stenosis is almost same in both the group, that is Jotralimus and the Everolimus group. So all the real world data, the meta-analysis and the imaging study, they found out that Everolimus Eluting stent is better than the paclitaxel eluting stent, and it is almost comparable to the Jotralimus Eluting stent. Now coming to this data about the retrospective study, that is phase 4 trials of the Everolimus Eluting stent, that is Everpro. So this Everpro is from the SLT, that is Resonance Laser Technology, and this Everpro as a very thin strut technology with a biodegradable polymer, and it has an innovative S and C linked 8 crown design, and also the foreshortening is very minimal, that is less than 0.2%. So this is a retrospective single-arm and the multi-centric and observational post-marketing clinical follow-up study where 500 subjects have been enrolled, and this is cleared from the ethical committee and the quality of standard care. And the main object of this study is to evaluate the safety and performance of the Everpro, that is Everolimus Eluting Stent, in patient with a de novo coronary artery disease under a real-world setting. So the primary endpoint is a target lesion failure that is from 12 months, but more follow-up data is coming. So follow-up is taken up by 12 months, 3 years, and 5 years. There is multiple secondary endpoint, that is cardiovascular death, target vessel myocardial infarction, clinical driven TLR stent thrombosis, target vessel failure, target vessel revascularization, device success, procedural success, and quality of life. So all the patient implanted with the Everpro, that is Everpro Cobalt Chromium Everolimus Eluting coronary stent system, will be included in the consecutively as part of the study. The excluded criteria is the same as the other trials. So mostly the patients which has been by medical history is differentiated between the diabetes mellitus and hypertension constitute the most of the patients, and other the smoking. And regarding the ACS, the most patients are from stable angina, and in the ACS STEMI taken the main proportion. So the is mostly around 60 plus minus 10, and that is male female ratio is 73% versus 26%. Now we'll come to the what is the lesion morphology. Mostly single vessel disease have been taken up, and SCCH classification are a B2 classification lesions are mostly taken up. So what is the result is that there is no incidence of TLF observed at 12 months follow-up after implantation of Everpro DES1. The device success rate is almost 98.5%. So we will not go to this particular study, just highlighted this study because this has only 500 enrolled patients. So there is no cases of stent thrombosis or CDTLR or all this taken. More long-term follow-up is needed to actually establish this stent's outcome. But this is a short-term trial, short-term study. So only 2 year follow-up. But in a nutshell, we can say that Everolimus Eluting stents has a better efficacy and almost similar result to the Everolimus Eluting stent, and should be, and in the for the diabetic populations, and also from the stent morphology like bifurcation and the complicated the coronary anatomy, the Everolimus Eluting stent has a better result. So the present study demonstrated a favorable safety and performance of Everpro DES1 for improving luminal diameter and reducing the restenosis for the treatment of de novo lesion in the native coronary arteries in patients with a reference vessel diameter of 2.25 to 4.5 millimeter in patient eligible per PTCA. Overall, the finding of this interim study report provides an essential insight into the outcome of the study with a lowest rate of MACE and demonstrated the value of conducting rigorous and comprehensive research. So MACE had not occurred through the 12 months follow-up period, which established a basis for the early clinical safety of this device, but longer-term follow-up is needed for a better outcome, to know the better outcome. Thank you.